What are the typical wrong interpretations what people have?
But you'll not believe there have been so many myths around menstruation world over.
Irregular periods. Is it really a genetic disorder?
When do we say periods are irregular? Up to 8 years after the menarche, we take it as almost normal to have irregular cycles. In polycystic ovaries, the ovulation itself is aberrant. It is not happening there.
So what is PCOS?
16-year-old girl, polycystic ovaries, 18-year-old girl, there is no meaning to that. But there is a range of treatment available for conception in these women.
So how women should take care of their fertility after 35 or after 40 years before menopause?
Women now, they don't have to stop their careers, take a break or pause from their careers just for fertility. But all they have to do is store their eggs.
What is IVF?
IVF is in vitro fertilization. It's not something that women cannot go.
What is endometriosis?
Adolescent endometriosis is very much a reality, and we have been seeing them more often as well.
I was listening to something on the Mahabharata series. The birth of Kauravas was like matching with what is today's IVF.
There are many such anecdotes in Mahabharata. Mahabharata, through the prism of reproductive endocrinology, I can give you various instances.
Let's go deeper as much as possible.
Yeah.
Thank you for coming.
Yes.
And finally we are doing.
Yes.
And before we start, just wanted to congratulate you that the first robotic surgery from your side
Yes.
has happened yesterday. So tell us more about it. That's on your subject. Before we dive into the other subjects, what happened yesterday? What you did?
So yesterday, it was a case of a doctor, and it was a huge uterus. She had severe adenomyosis with lots of fibroids.
What is adenomyosis?
Adenomyosis is the inner lining of the uterus will get into the wall of the uterus. Normally, it should be there in the inner lining itself. But it gets into the wall of the uterus and it starts growing there. So every time periods happens, the inner lining of the uterus goes out as periods. But this tissue which has gone into the wall also keeps bleeding, but it has no way out.
Yeah.
Okay, so it will bleed within that tight space.
It gets stuck out.
Tight space, it is stuck there, and it causes excruciating pain.
Yeah.
These women with adenomyosis can have lots and lots of pain. And to accommodate that tissue, which is growing day by day with every periods, the uterus also grows bigger and bigger and bigger. So with more bigger uterus, there is a lot of pain. There's pulling of the, the backache, severe backache. They can have pain in their legs. So it's a condition which starts initially as pain during periods, but it extends to throughout their month. Throughout the month, they will have a lot of pain. So when the women are around perimenopausal age group, that means they've almost completed their family or the uterus has done its work, then the way we deal with it is removal of the uterus. Since this was a very big uterus, we were expecting adhesions. Adhesions means there will be, whenever there is adenomyosis, the intestines, everything can be stuck to it. It will be a major difficult surgery. So we planned a robotic surgery for her. And even though it was a big uterus, it came out beautifully.
How were you doing it earlier before the robotic came into the picture?
We do it laparoscopically. So laparoscopically, now what I can say is, see, robotics, you see the kind of magnification. It is a 3D view over there. Of course, you have 3D even in laparoscopy now. But if you're doing a 2D and you're going to robotics, you see a 3D vision and you can go as close to it as if you're just
seeing in front
of it. Yeah. You can see every fiber and the blood vessels, so much real in front of you.
How sensitive is that robotic arm when you're trying to?
Very sensitive. Very sensitive. You have to be very mindful. Even millimeters you move here, it can translate into bigger movements over the patient's body.
Yeah.
So you have to be very mindful of how you are doing your movements here.
Yeah. So
the advantage here being, since the ports are all fixed, the ports don't move. It's only the robotic arms that are moving. Patient will have very less pain. The ports as such, they become very painless, and patient doesn't take much time to get back to their work. So the recovery is very quick, morbidity is less.
I was about to come to the point, how long the entire process happened?
Process takes around 3-4 hours because this was a big uterus. and we took time to morcellate. Morcellate is, see, whenever the uterus is big, normally we remove it through the vagina. But in this case, it was like around 4-5 months pregnant uterus size. So it's a big uterus. And to remove that, we cut it into pieces from below and take it out. So that takes time. And docking and undocking is what we call, that is arranging the robo on the patient's body and removing it out of the patient's body. So this takes little time. Overall, it took around 4 hours or so.
Is it done on local anesthesia or
No, it is general anesthesia.
general anesthesia?
Yes.
Now coming back into the subject of what we intend to share it across, let us first debunk the myths and wrong interpretations of menstrual cycle.
Yes. See, menstrual cycle is something very unique to women. But this has been in different cultures, not just in India. In India, of course, we have seen so many myths around menstruation, but you'll not believe there have been so many myths around menstruation world over. If I can tell you about one by one, in India, it is thought from a long ago that menstrual period or the blood is very impure.
Kind of a taboo.
Taboo, yes, it's a social taboo. And women are thought to be impure. The blood is thought to be impure. They should not touch. They should not go to the temples. This was all a thing of the past. Over the time, it has, the people also have overcome all these things. And the things have changed with greater awareness and with greater education.
Yeah.
But, when you study these, it's very surprising to know that the similar things are there in women in Africa, in some South Asian countries, and even in the South American countries, and even in Japan. The Buddhists in Japan, they think that they should not go to the temple around this time. And there are few communities which think that women can be really dangerous, dangerous during these menstrual periods. And they can be used for black magic and other things as well.
Yeah. But do you think those kind of thought process, one way or the other, is on the religious or the social point of view? But what are the typical wrong interpretations what people have, that what women go through during menstrual cycles? What kind of wrong understanding they have? What women will go through during the menstrual cycle? This is what we wanted to understand.
The most important thing is, as I said, it is the impurity. Women should not touch certain foods. They should not touch even plants. Because they think that the plants could dry because of this. And they think that women should not go to the temples because you may rob the deity of its energy or the power. Okay. And touching water can make the water impure. Okay, so these are the
kind
many things that are there.
But in terms of understanding, the one is on the menstrual part of it. But do you think irregular periods for women, is it a genetic disorder where, suppose a woman says that today I don't have periods in this month, and just because my mom also used to have months of irregular periods, my grandmother used to have months of irregular periods, so the same thing is coming across to me. We call it as PCOS nowadays on this subject, but before getting into the PCOS, is it really a genetic disorder, these kind of irregular cycles, or it's more of that particular females, the body is not reacting or behaving in the way it's supposed to be?
So if I can take you by the age, when do we say periods are irregular? Normally a woman will have a periods, something like 21 days to 35 days, we take it as normal. Anything less than 21 days is early, and anything more than 35 days can be a delayed periods. Okay, so irregular is, it can be early periods, it can be late periods, and it can be heavy flow, it can be less flow, everything we take it as irregular. Or you see bleeding in between the periods, even that is irregular. If there is irregular periods, if we go by age, say in women, in young girls who have just attained menarche and they are in their adolescence, it is still normal. up to 8 years after the menarche, we take it as almost normal to have
Normal.
irregular cycles. At least for 2 years, we really don't think about the irregularity of the periods. The same we can say about the perimenopausal women.
What does
Just
that mean?
before the menopause, there is an time of say around 2 to 5 years to 7 years in some women before the onset of menopause, which shows all the changes of the menstrual cycles, the moods, everything changes around this time. So if we take woman's life, we can divide it into multiple phases. One is pre-puberty, wherein the young girls are still not having any activity, and it is puberty. Then post-puberty, it is a very early teenage, and it is the reproductive age group where the women are actively they can procreate, and perimenopause. Perimenopause is they are just before their menopause. Around 7 to 8 years before menopause, we call it as perimenopause. And menopause is a time which we take retrospectively. 1 year they should not have periods. Then we call them as menopausal. Okay, so a woman is born with a set number of eggs. As these eggs are exhausted, you get into menopause. When the eggs are abundant, they can reproduce. So this is how it is. So around the age of puberty and around the age of perimenopause, it is very common to have irregular periods. But if you take certain conditions like polycystic ovarian disease, thyroid issues, and hormonal imbalances, it is not a normal thing to have irregular periods. So whenever there is irregular periods, we always see whether they are adolescents or perimenopausal, or do they really have some hormonal imbalance. There can be certain conditions like irregular fibroids present in the cervix or in the vagina, or at times even adenomyosis. They can all produce irregular menstruation. So there are various causes.
But it's not a genetic one.
It can be genetic in many women as well. See, polycystic ovaries is again partly genetic. So women who had polycystic ovaries, say they can transmit the same genes to their kids, and they can also have polycystic ovaries.
But that's not a healthy sign, right?
It is not. It is not always.
So what should be the point of concern for them, that how they should evolve from what genetic, I'll not use the word disorder, but I'll call it as deficiency, to make it more healthier than their predecessors.
Yes. So if you're talking about polycystic ovaries, what polycystic ovaries actually means. The name goes by polycystic ovaries. That means the ovaries are a pair of organs that are present on either side of the uterus. And these are the organs that harbor the eggs within them. Okay, so these eggs, every month they are exhausted from the puberty to the menopause. Every cycle, for every cycle to produce one egg, at least thousands of eggs are wasted. Now, that means egg is coming out of the ovary. This coming out of the ovary is what we call as ovulation. When the ovulation happens, there are multiple hormonal changes happening, like estrogen production, progesterone production, and these are the hormones which are maintaining the women's hormonal milieu. Okay, so in polycystic ovaries, the ovulation itself is aberrant. It is not happening there. So when ovulation doesn't happen, the woman has only estrogen, there is no progesterone, and there can be more of androgens as well. Okay, so this hormonal imbalance that is happening leads to most of the problems that we see in polycystic ovaries. So these women are usually obese, they don't have their regular periods, they can have a lot of acne, they can have a lot of hair on their chin or beard area and other parts of the body. So this is all because of hormonal imbalance leading to increased androgens, which is a male hormone. So these are going to interrupt the menstruation as well. So no menstruation, basically no ovulation, no menstruation, that leads to no children as well. So it not only causes irregular cycles, it leads to infertility, and it can in the long run lead to even endometrial cancer. And during pregnancy, it can cause hypertension, diabetes as well. So it's not just about irregular periods. It can lead to so many things till the time of menopause also, like endometrial cancer, if it is not taken care of or if it is not treated.
So is it kind of, or is it also called as PCOS? Or is
Yes.
it, yeah?
Polycystic, that's why it is called as syndrome.
Yeah, syndrome, that's what I mean.
Syndrome, because it can involve insulin resistance, which leads to diabetes, hypertension, and even endometrial
So
cancer.
what is PCOS?
Polycystic ovary syndrome, it will encompass all these things.
Mm-hmm.
You will have insulin resistance, obesity, and androgen excess, which leads to menstrual irregularity, infertility, and metabolic syndrome, and endometrial cancer in some. Okay, so this whole syndrome, we take it as polycystic ovarian syndrome.
And is it very common nowadays? Because there was some article which I was reading some time back where, again, not going back deep into the numbers, they said 1 out of 3 is getting this PCOS, or
Yes.
some saying 1 out of 5, or whatever it is there. Is it that common nowadays that the women are getting into PCOS? Or
Yes.
yeah,
See, you take, it can vary, 1 in 5 to 1 in 20, depending on what community you are looking at, or what subset of women you are looking at.
Can you elaborate?
Especially, see, the lifestyle. Urban women,
Yeah.
and women who are basically working on their AC rooms and this one, with not much of mobility. So sedentary lifestyle and a bad lifestyle can lead to a lot of these kind of changes. It's basically a lifestyle disorder too.
Gotcha.
Okay, so women who are working in the fields, doing a lot of physical activity, they are less likely to have this kind of problems. So basically, dealing with lifestyle issues can, to a great extent, take care of this as well.
So it's mainly only the lifestyle, or you are also talking about PCOS also comes because of the genetic disorders within the...
Yes. See, it's a complex thing.
I'll not use the word genetic disorder. I'm
Yeah.
sorry. Let us use the word genetic kind of a deficiency.
Yes. So I will explain it in this way.
Yeah.
A woman who is predisposed genetically, okay, that means she carries genes.
Yeah.
It may be single gene, multiple genes. Okay, she carries those genes from her mother. Okay, whenever a woman is predisposed with these genes, and she gets exposed to an environment, okay, which will alter these genes.
Like what?
So you have a gene now.
Yeah.
Okay, this gene carries a deficient trait.
Yeah.
Okay, there is some defect in that gene.
Got it.
Okay, but it is still not manifesting anything, any disease.
It is not showing this character.
Not showing any problem. There is a woman who is very physically active. There is a woman in a rural area, a woman who is in an urban area, who is sedentary, who is obese, who is eating lots of processed food, packaged food. You say anything, everything wrong with her lifestyle, with her food habits, with lack of exercise.
Yeah.
Okay, but a very active person.
Yeah.
In a very good environment.
Yeah.
See, these women are exposed to different kind of health settings, and different kind of environment.
Yeah.
So this defective gene in both the women expresses differently. They behave differently in different situations.
Based on the lifestyle?
Exactly. So this is what we call it as the environmental influence on these genes.
Yeah.
So whenever a woman is exposed to this kind of an environment influence, and she has sedentary lifestyle and all the bad habits that she can have, with this there can be changes in her genes. So this could lead to...
So those genes gets activated.
Yes. So basically, if you maintain a lifestyle, even if you are predisposed to a particular condition, you can still keep them away.
Does the personalized medicine has come into effect for these kind of...
Sorry, I didn't get you.
The personalized medicine.
Yes.
Has it come into usage of these kind of treatments? We are not gone into treatment kind of a discussion at this point of time, but even for diagnostics, or even getting into personalized medicine for this kind of one, is it really into use now, or is just in a discussion stage, or still it is not coming to the practical use of it? Because there are some diseases where, at least what I have seen in my career, was they screen the entire DNA. They'll identify which of the genes which is having as you rightly mentioned, that having that kind of a character where they will pop up at certain point of time because of the genetic inheritance which carried it from its paternal or maternal side, and gets activated because of the lifestyle.
Correct.
It can be hair loss or eyesight, or
Yes.
even blood pressure, heart related, cardio related, or kind of a thing. Now, related to PCOS, someone has done any kind of a personalized medicine kind of a testing or kind of not at this point of time?
No, not yet. Hmm. Because see, it's not going to work out doing it for every person as
Yeah, yeah,
such.
yeah, yeah.
There is a particular Rotterdam criteria that is there. You see those criteria in a person, yes, you label them as polycystic ovaries. You know what polycystic ovaries is. So the first and foremost thing that we do is take steps so that they don't develop the actual manifestations of that.
What is the treatment for PCOS?
See, treatment is a young adolescent girl presents to us with symptoms of polycystic ovaries. We often see the scan report saying that 16-year-old girl, polycystic ovaries, 18-year-old girl. There is no meaning to that. Around that age, we are really not concerned about polycystic ovaries. It's only the lifestyle modification that we tell them. We can reassure them basically over there. But when it comes to women in the reproductive age group, and she is planning for fertility and she is unable to conceive, yes, these are a legit group of women who can definitely present with infertility. And polycystic ovaries could be a big cause in them. In them, we definitely take them through lifestyle changes, which includes diet, exercise, and stress reduction through meditation, mindfulness, yoga, many other things. And here we also take them through ovulation induction. And it's a big art in itself, that is ART as well. Okay, so that is assisted reproductive techniques are used in women with polycystic ovaries, which can range from very simple ovulation induction tablets to as big as IVF treatment as well, which some women with polycystic ovaries require.
Yeah.
But there is a range of treatment available for conception in these women. Earlier, it was very difficult for women with full-blown polycystic ovaries to conceive. But now that's not the case. These women conceive too and have healthy babies. Now, when you come to the pregnancy part, polycystic women with hypertension, with gestational diabetes, yes, they are again managed particularly with regard to that. And when it comes to prevention of endometrial cancer, they have delivered, they have one or two children, but they are in a stage where they have to take care of their health, that is around perimenopausal age group. So we target them for screening every year for the complications that they can develop. And if they are going for endometrial cancer again, so they are taken care of with that. It is basically screening throughout. Once you know that a patient has polycystic ovaries, you have to screen them every year so that they don't have problems now and they don't develop problems in the future as well.
So the lifestyle is something which has to be taken care of.
Absolutely.
What kind of
So
lifestyles?
just with lifestyle, you can manage this whole condition.
What kind of lifestyles you would suggest for people, especially in the urban area?
Urban area, especially, see, food. First and foremost, food. Second thing is sleep. Third thing is activity. And fourth thing is stress management. If I can just divide into these four things, the simplest way of telling you this. Food, whatever you cook at home is the best food that you can have. And if you have a balanced diet on your plate, nothing like that. Avoid processed food, avoid packaged food, and eating out multiple times outside can give you a lot of salt, a lot of carbohydrates, unprocessed food, which in itself increases the calories and all the see, basically what all these things do is increase your insulin resistance. More insulin resistance, it leads, and also obesity leads to polycystic ovaries. So it's a vicious circle. So taking care of food and then the exercise. Exercise at least 30 to 40 minutes of just walk will not help. Okay, walk with some strength training will definitely help your muscles pull up all the extra sugars that are there in the body, and that can help your insulin resistance and make your menstrual cycle regular as well. So with good 30 to 40 minutes of strength training exercises, that can take care of the polycystic ovaries as well. And stress is the biggest factor.
Especially in the urban areas.
Yes. Stress is a great factor. Women in urban areas, the way they multitask, it is really, hats off to them. The way they multitask. So yes, you can't avoid women from doing all those work, isn't it?
Yeah.
But they should know how to, tackle their stress as well.
Handle it.
Yes, handle the stress. And probably they can put one more feather in their cap by, knowing how to manage the stress as well.
Yeah. Let us talk something on the fertility after 35, 40 years. Since PCOS is having a bigger impact on the community, or will have a bigger impact on the community in the coming years because of the lifestyles kind of a thing. So, how women should take care of their fertility after 35 or after 40 years before menopause comes into the effect?
Yes.
What kind of lifestyle and what are the challenges they would be facing in their body to maintain that fertility? And what kind of a treatment or what kind of a solutions which is offering by the community to the
Yeah, see, you have raised two important questions here. One is the question of the ovarian reserve.
yeah.
So, what happens to the ovarian reserve as the women age? And the second thing is of cryopreservation of oocytes.
What does that mean?
I'll tell you in detail about
Yeah.
this. So, first, ovarian reserve. Ovarian reserve means the woman is born with a set number of eggs. From puberty to menopause, these eggs are utilized. Okay, and as the women age, the number of eggs, every month there is exhaustion of these eggs. For one egg to come out, thousands of eggs are wasted.
Yeah.
So as the age goes by, the
Yeah.
pool of this eggs will go on decreasing.
Yeah.
So when a woman attempts pregnancy,
Yeah.
around say 24 to 30 would be the best time to conceive.
Mhm.
But if a woman attempts it after 35 years of age,
Yeah.
the egg pool is reduced.
Right.
Okay, so when they come first to us, what we see is that the number of eggs in their ovaries are less. We call this as poor ovarian reserve, POR. Okay,
And how do you do that? What
Yes,
kind of a
so-
testing you do that for
yeah,
that?
so it's a simple pelvic scan. That is an ultrasound scan that is done on second or third day of the periods to check how many eggs are there. We call it
Okay.
as antral follicles.
Okay.
So within the ovaries, you can see black dots, which are the eggs.
Okay.
So we count these eggs. There should be a particular number of eggs when we call it as adequate.
Okay.
Okay, like 5 to 10 is said as adequate. Anything less than 5, we take it as less. So women having less number of eggs, we do a test called as AMH. That is anti-Mullerian hormone. It's a blood test. So blood test, which is showing lesser values, scan, which is showing lesser number of eggs. We label these women as having poor ovarian reserve. So we take this subset of women and counsel them and keep them motivated that, either they should go for pregnancy if they are planning for it. If they are not able to have a pregnancy anytime soon, they are at least motivated to preserve their eggs.
Eggs.
So this is called as cryopreservation of the eggs.
How do they preserve the eggs?
See, it's similar to the process of in vitro fertilization, wherein the woman, even if she is unmarried, she will go through the process of IVF, wherein the eggs, the injections are given for first 12 to 14 days. Where we see that normally only one egg comes out, but in this IVF procedure, what we do is we'll give the injections from day 2 to day 14. Make sure that whatever egg is possible in that cycle are taken, are harvested. So if you get around 10 to 12 eggs, well and good. So we will take them out through a small procedure wherein we insert the needle, a long needle will be there. So that needle is inserted through the vagina and all these eggs are taken from the ovaries and they are frozen in the lab. These can be frozen for quite some time till she is ready for her fertility. Even before she gets married, she can freeze these eggs and keep them. So that, women now, they don't have to stop their careers, take a break or pause from their careers just for fertility. They can do it at their convenience. But all they have to do is store their eggs.
Just
So
an egg bank.
women have to be mindful about their eggs, go through regular screenings every year, probably at least after 30 years of age. Do the screenings. If there is a likelihood that she's going for less number of eggs or AMH is going to be less, at least preserve the eggs.
So coming back on the subject, what is IVF?
IVF is in vitro fertilization.
Yeah.
That means you're going to develop the embryo outside the body. So normally what happens in the body? After intercourse, the sperms will ascend from the vagina. They'll go into the uterus and go into the fallopian tube.
Yeah.
Okay. At the same time, the egg ruptures. This is around the mid-cycle. The egg ruptures. Egg is picked up by the fallopian tube and it reaches the tube. So egg and sperm will meet in the fallopian tube. They'll come back and grow in the uterus. This is what normally happens. Okay. But if a woman is not able to conceive naturally, the same procedure is replicated outside the body in the labs. So this process is called as in vitro fertilization. In vitro is outside the body fertilization.
Controlled environment.
Correct. So what you do is you take the eggs from the woman, you take the sperms from the man, you fuse those two under a microscope. Once they are fused, it is called as embryo. Okay. So this embryo is grown for 3 days to 5 days. And then once it is ready, it is placed inside the woman's uterus. So it starts growing inside the uterus. This process is called as in vitro fertilization.
And does the regulatory body in India, does it have any restrictions about IVF, or how does it?
Yes.
What kind of restrictions they have?
Restrictions for age, not more than 50 years can you do the IVF procedures.
Okay.
And for the donor programs, there are restrictions. For the surrogate programs, there are restrictions. It is legally well controlled programs.
What kind of restrictions for the donor and what kind of restrictions for surrogates?
Yes, woman can donate only once the eggs, and she should have delivered once to prove her fertility, that she is a fertile woman, her eggs are worthy of taking it, and she should be a young woman. Okay, so these are the restrictions for the women. For surrogacy, again, she should have delivered once. So these are some of the guidelines rather than restrictions. These are the guidelines to make women's health also safe. Those who are donating, those who are becoming surrogate, even their lives have to be safe. For that reason, the guidelines have been created.
Can we dig deeper into a more minute way of understanding how the entire IVF process happens outside the body but in a controlled environment? How does the entire process happens?
Yes. So IVF is an elaborate procedure, but it's not a very, it's not a risky procedure. It's not something that women cannot go. For the kind of result that it gives, it's a great procedure. Okay, so there involves investigations, knowing how the woman's body is in the first cycle. Once it is decided that the couple has to go through IVF.
What do you mean by first cycle?
First cycle is first month of them coming to us. We need at least 1 month to see, do the investigations, do the scans, and figure out what the couple is facing, what problems they are having, and what plans we can offer to them. So 1 month goes in that, and subsequent month, once we have framed a treatment plan for them, it starts from, the IVF process actually starts from day 2 or day 3 of the cycle. Cycle is, when I say cycle, it is the menstrual cycle, starting from the day 2 of the periods. Okay, so from there, roughly, it involves 3 processes here. One is giving injections for the egg to develop to the lady. Second thing is retrieving these eggs which have developed with the help of injections. Now we do this with a small procedure called as oocyte pickup. And the third process involves growing these eggs as an embryo in the lab and putting them back into the uterus. That is embryo transfer.
The second process, what you said, does it happen with general anesthesia?
Yes, it is with general anesthesia. Okay. So the injections goes on for say 10 days to 14 days in a woman. And why we give this injection is that instead of 1 egg which is produced every month, we take more than 1 egg. Take those eggs, harvest it on the oocyte pickup day, wherein a big needle is used and it is inserted through the vagina under general anesthesia. It's roughly around 10 minutes procedure. And harvest all those eggs and store it in the incubator after they are fused with the sperms. And an embryo is created. So once the embryo grows for 3 days, 5 days, they are brought back into the woman's womb. So this transferring into the woman's womb is called as embryo transfer. It's another procedure which is done on day 3 or day 5. Not necessarily all women will require anesthesia. Most of them are done without anesthesia. But some women will definitely require anesthesia for doing this transfer.
Based on their...
Based on the particulars of the patient. So after this transfer, it's roughly around 14 days when we get to know whether the woman is pregnant or not. So overall, it's a 1-month procedure involving giving injections for the growth of the eggs, retrieving the eggs, creating the embryos outside the lab, putting it inside the uterus, and waiting for pregnancy.
What's the success rate of this process, the third one?
Yes, success depends on various factors. The most important could be the age, and younger age women have got better results. Better in the sense, say around 40 to 50% results less than 35 years of age. More than 35 years of age, the success rates drops. It could be around 30%, 25 to 30%. In more than 35 to 40, around more than 40. More than 42, it can be further less, around 10 to 20% also. So this is a lot dependent on the oocyte quality or the egg quality. Okay, and there are other factors like patient having endometriosis, the results can be less.
Yeah.
Like it goes down to around 30% or so.
I was planning to come to that.
Yes.
Yes.
So
that
we'll
is
talk
something
about
which
it.
we need to talk about it.
Yes.
Yes, please go ahead.
And if a woman goes through successive cycles of in vitro fertilization IVF, that is like say 3 cycles of IVF ET, then the cumulative pregnancy rate can be as high as 60 to 80% also.
Okay. Since you raised the topic, what is endometriosis?
Okay, so endometriosis needs, can I explain it in detail?
As much time as you have.
Yes. So a woman's body, the reproductive organs have got a uterus, 2 ovaries, and 2 fallopian tubes. There is inner lining of the uterus. This inner lining of the uterus, every month it is getting ready in anticipation of a pregnancy coming into it.
Yeah.
So if there is pregnancy, it will provide nutrition to this baby.
Yeah.
If there is no pregnancy, which happens in most of the cycles in a woman's life, she may probably conceive twice or thrice at the most, or 4 times.
Yeah.
All the other cycles in a woman's life will be, there is no pregnancy. Hence, the endometrium or the inner lining of the uterus will be shed out.
Yeah.
Now, this is shed out in the form of menstrual blood.
Yeah.
We call this as menstruation.
Yeah.
So the amount that goes outside the body as menstruation, some amount also goes through the fallopian tubes into the tummy, around the ovaries as a blood that gets collected around that region. This happens in every woman. So some amount of blood going into the tummy during the periods is very much normal for every woman. But only some women will not respond to this greatly. The ovaries will not like this. If I can say in very simple terms, the ovaries don't like it. There gets a collection within this ovary. This collection with every period, it goes on becoming bigger and bigger. So the ovary is collecting blood within it.
Supposed to be going out. Which
should be going out is getting collected there.
Yeah.
So this is what we call as chocolate cyst or the endometriotic cyst. Why we call it as chocolate? Because the blood, when it gets collected over time, it becomes something like a dairy milk.
Yeah.
Exactly like a chocolatey fluid within the ovary.
Yeah.
Now this chocolate fluid within the ovary, it will attract everything that is there surrounding it. Like you have uterus, you have around the uterus the fallopian tubes which are freely floating, the ovaries which are freely mobile, and you have the intestines behind, and you have the urinary bladder in front.
Yeah.
All these are our neighbors, the uterus and its neighbors of the ovaries.
Yeah.
But ovaries, after harboring this endometriotic cyst, it will start attracting everything around it. Now, basically what this does is it keeps pulling the spine also in such a way that the patient has lot of pain during the periods especially. To start with, they will have pain during the periods. And this period pain, we typically describe it as triple dysmenorrhea. It can be before the periods, during the periods, and after the periods also. So it can be, really tough on the women to go through this kind of endometriosis pain. And women with endometriosis usually, will not miss them because they will have a lot of pain.
Yeah.
And apart from this pain, they can present to us with infertility because the tubes are all stuck. They can present with constipation, or they can present to even, the other departments like gastro department with intestinal obstruction as well, wherein they are not able to pass motion, they are not able to take anything, they have a lot of vomiting. This is like extremes of cases of endometriosis.
Yeah.
Mostly what we gynecologists or laparoscopic surgeons see is endometriosis developing in the reproductive age group women with ovaries having this cysts, which are causing infertility. So this is what we call as endometriosis. Not that it is seen only in reproductive age group women. We of late have started seeing these in young girls as well. Adolescent endometriosis is very much a reality, and we have been seeing them more often as well. And even around perimenopause and just before menopause also it is a possibility, but more so seen in the reproductive age group women.
What are the treatment for it?
Treatment, again, we will take it as the patient comes, depending on the age and depending on what they want, whether they want pain relief, whether they want pregnancy. Okay, so depending on that, we tailor the treatment to every patient in a different manner. Adolescent girl, coming to us with endometriosis, we have to deal with her more
For the
so
long term.
Yes, long term. Why long term? Because endometriosis is a condition which is not going to disappear once for all.
Yeah.
It is a condition which will recur every time. Just like how you get periods every month, endometriosis also can keep developing every month.
Yeah.
So we have to manage this till the time of menopause.
Yeah.
So it's a big deal when it happens in adolescents.
Yeah.
And mostly we manage with medical management till at least they plan their pregnancies, or till it becomes very, very painful for them.
Yeah.
And when they present to us in reproductive age group, they are looking at fertility as the option. Then we decide for either surgery or medical management or directly with IUI or IVF. So these modalities will help them. There, our aim is to see that they conceive at the earliest.
Yeah.
It is not the treatment for endometriosis, but the conception is the important thing that we are looking at.
Yeah.
And during pregnancy, most of these women, the endometriosis disappears. The beauty of this endometriosis is during pregnancy, it is quiescent.
Yeah.
You don't see this endometriosis at all.
Because the body gets what it wants.
Yes.
Yeah.
So the hormonal changes are such that during pregnancy that there is no endometriosis. Many times we have seen during cesarean for endometriosis women, when we are doing a cesarean section, the ovaries are absolutely small, okay, which were actually harboring big cysts. They will disappear during the pregnancy. But it's not the same case again after delivery.
Yeah.
After delivery, we have to again manage them. So we always counsel them.
Yeah.
Just because they have delivered doesn't mean they have to forget endometriosis.
Yeah.
We have to treat them.
Yeah.
But it's more easier managing these women after delivery. After one delivery, we place something called as Mirena inside the uterus.
What is that?
Mirena, or it's an intrauterine device which will be releasing progesterone. It's a hormone.
Yeah.
Instead of giving them orally medications, we insert this device into the uterus and make sure that device releases the medicine, what is required for a day. And that is managing this endometriosis for the next 5 years.
So it will be inside the body for the 5 years?
Yes, for 5 years. So it is so much easy for the woman, if this suits her, that next 5 years she need not worry about the endometriosis.
Does it not harm or
Yes, or she wants another pregnancy, she can get it removed just in the OPD. It's a very small procedure removing it, and she can plan for one more pregnancy. But we have to manage these women till menopause again. Yes, sometimes the harm is in the form of intrauterine device.
The pain, does it?
No, pain it definitely brings down, especially in women with endometriosis and adenomyosis. Mirena is a great boon for women. So many surgeries can be avoided. Recurrence of endometriosis can be avoided. Pain during the adenomyosis conditions can be avoided with Mirena. And it's also a contraceptive device.
Should women keep, like the way how they keep their finances as a track of what's happening every month kind of a thing? Should they keep a track of their the regular periods as well for their own health chart monitoring kind of a thing? Do you think that should be something should be followed by them?
Yes, absolutely. Nowadays, most women have started tracking their menstrual cycles through menstrual diaries. You have got various apps on the mobile. Okay. Whenever we ask patients about how their menstrual cycle, we get the mobile phones with their apps open, and how beautifully it shows the ovulation time and when they need to have intercourse if they are planning pregnancies, or if they do not want pregnancy, what are the days where they can conceive and to avoid these cycles. So it's a very flexible thing for women to keep an account of their menstrual cycle through the apps. If not apps, they can even monitor them just by keeping it on their digital diary or even the calendar, the best method, for most women, or even by remembering. Many women come saying that, yes, it was that Amavasya or this festival. So they even remember it correlating with the multiple events in their lives. But this helps them in tracking their symptoms, tracking some women have a lot of pain before the periods or during the periods. So they will manage and they will keep track in such a way that they don't keep major events around that time. Or when they come to a doctor, they have to show the records. For that, they keep the diaries. But most women, they are, they want to know how their bodies behave.
The reason or the inspiration for me to talk to you came from one of the, I don't know whether it was a podcast or something, where I was driving and I was listening to something on the Mahabharata series, where the birth of Kauravas, some of the things what I heard was like matching with what is today's IVF. Kauravas, they are like 101 siblings kind of a thing. I'm sure you're aware of it. And I believe there is an author who has written some kind of a novel or a book or article on this. Dr. Madhuri, are you aware of it?
Yes. See, in fact, the reproductive medicine, or Mahabharata through the prism of reproductive medicine. This is an article which was...
Who's the author?
Dr. Bharti Kalra. She's an endocrinologist.
Is it online?
It is there, yes. Okay. It is online. So
because I heard the birth of Kauravas, where a big chunk of flesh comes out of the womb, and they divide it into 101 pieces.
Correct.
And they kind of put it across in a pot with ghee and some herbs.
Correct.
And it comes to life, and that's how they become what they are. So it's like incubation outside the body, and again giving the right nutrients to bring it back to life in some way or the other.
Yes.
Which author you're talking about? Can you explain more on that?
There are many such anecdotes in Mahabharata. When you see Mahabharata through the prism of reproductive endocrinology, I can give you various instances.
Let's go deeper as much as possible.
Yeah, I think...
If we have another 10 minutes.
Yes.
Yeah.
So these are very interesting stories when you correlate it with reproductive medicine.
Yeah.
And of course, this is an article published in JEM, that is Journal of Endocrinology and Metabolism.
Okay.
So here they have tried to correlate all the events some events in the Mahabharata with what exactly is the reproductive endocrinology part of it.
Okay.
So I can talk about the IVF. I can talk about ovulation induction, parthenogenesis, then ovulation in...
Take couple
there
of
are so
topics.
many things about
Take
it.
Couple of topics like IVF or anything what you wish. Yeah.
So maybe I'll start from what I can say as epigenetics.
Yeah.
Wherein, Satyavati. Okay, I'll go with this story then.
Yeah.
That becomes easier.
Yeah.
Satyavati, son is Vichitravirya. Vichitravirya has two wives.
Yeah.
Ambika, Ambalika.
Ambalika.
Amba doesn't get married.
Yeah.
So she will go away. Yeah. Whereas Ambika and Ambalika will get married.
Yeah.
But Vichitravirya dies even before he gives a progeny.
Yeah.
So Satyavati wants to take her, the lineage forward, and she calls in her son, sage, Vedavyasa, and he comes. This was in the, in those days, the surrogate fatherhood, or that was a valid thing and it was a legal thing. Yeah. So she calls her son. Rishi Vedavyasa comes, and when these women are exposed to Vedavyasa, so they respond in different ways. When Ambika goes inside, when she sees Vedavyasa, she is so much shocked,
petrified,
and she closes her eyes.
Yeah.
When she closes her eyes, she gives birth to Dhritarashtra, who is blind. Next, Ambalika goes in, and she is so much petrified that she becomes so pale. She gives birth to a son who is having albinism probably. Okay, he is totally white. This was Pandu.
Yeah.
And then Ambika and Ambalika, they send in their maid,
Yeah.
and she is a very bold woman,
Yeah.
and she has seen the life, and she is not worried about anything. She goes, she greets him well, and she is very cool at that point of time, and she gives birth to a son, Vidura,
Vidura.
who is very intelligent,
Okay.
healthy, and he takes care of the Kaurava and the Pandu dynasty as well later.
Okay.
This is nothing but how the psyche of the woman or the external influence of the woman can be affected at the time of conception.
How the environment
Yes.
impacts the baby in the.
How the environment can impact the baby when she is exposed to such kind of situations. So this tale, it highlights the psychosocial aspects that can affect the intrauterine life. At the time of conception, what a mother goes through in her psychosocial aspects, this can definitely have an impact on the child that is being born. This is a debate even today, but if you go back to Mahabharata, you can see how it affected. And if I can tell you about, as you said, IVF and this one. So Gandhari, Gandhari thinks that she is pregnant, but Gandhari has still not conceived. So there is a lot of social binding on her, social pressure on her that she should become pregnant. Dhritarashtra is the eldest one, and to continue the lineage. So she imagines she is pregnant, and her tummy grows, but she never delivers. It's 1 year, more than that, she never delivers. This is a concept that is called as pseudocyesis, and this is a reality in even today. Woman thinks that she is pregnant, but she is not actually. And after some time, she delivers a stillbirth, something like a stillbirth, a mass. What they do with this mass is they cut it into 101 pieces and put it in pots which is with clarified butter or ghee, and they create an environment and try to grow all these fleshy masses, and finally the result is what you see as Kauravas with Dushala as the sister. So this, you can relate it to IVF in the present day scenario.
The entire process we're talking about.
Yes. If I can tell you some more tales,
please,
if we have time.
Then
we know parthenogenesis now. Parthenogenesis is asexual means of reproduction. That means there is no male female in this, but there is reproduction. So you have heard of Kunti. Kunti served Durvasa Muni. Durvasa Muni, very so he gives her a boon, that a divine boon. She can think of a deity, and a son or a daughter can be born out of that. So it is a divine boon. She wants to try it out, and even when she's a virgin, she tries, and Karna is born.
Test method,
try and test method, and Karna, she conceives with Karna, and she doesn't know what, she has to leave him somewhere. But the same thing, same divine mantra she uses when she marries Pandu. And Pandu has a curse that if at all he develops intimacy, he can die. That is also something called as fatal coitus. So he is fatal coitus is a reality. So what happens here is, Pandu at some he has killed a deer which were mating, and he is given the curse that whenever he is in intimacy, he will die. So this is really seen as, whenever a person is during the coitus, they can die, which can be because of subchorionic hemorrhage, or it can be the aneurysm that is rupturing, or it can be even aortic dissection. So many things are known, and pheochromocytoma crisis, these are all known, and it is called as fatal coitus. So perhaps Pandu was facing something like this. And because of this fear of fatal coitus, they never had intimacy, and still they had 5 children, Kunti and Madhuri, his 2 wives. So how was this? The divine mantra Kunti used, and this time she invoked Yamadharmaraya, and she gave birth to the Dharmaraya. And when she invoked Vayudeva, she gave birth to Bhimasena. And third was Arjuna. Arjuna was born after invoking Indra. The same mantra she gives to Madhuri, and she invokes Ashwini Devatas
Yeah.
and Nakula and Sahadeva are born. So this is nothing but parthenogenesis. There is no male component here, but they are giving birth, and this is what we can say as.
We can also view one more point that again, the external environment, whatever a mother visualizes or thinks about it, have an impact on the birth of the baby as well.
Yes, yes. And there are, some other tales as well. Yes, ovulation induction, if I
Yeah.
can say.
Yeah.
There was one, you must have heard about Jayadratha.
Yes.
Jayadratha,
Yes.
a ferocious king.
Yeah.
And, his birth is, very interesting. His father, Brihadratha, he had 2 wives. He had infertility. So, sage Kashyapa, he will, Kashyapa or Kaushika, I'm confused. So, he helps them conceive by giving a mango. Mango is given to him. He has 2 wives, so he has to divide it and give it to the 2 wives.
Yeah.
And, what happens is they give birth, but it is half fetus each.
Yeah.
So they think it is stillborn and not useful. They throw it away. A demoness takes it and she will fuse it, and he is the Jayadratha that is formed. Okay, so here what we can highlight is the mango that was given by the sage
Supplement.
was used as an ovulation induction in giving birth to the child. So every concept is there in Mahabharata. You see it through the reproductive endocrinology lens. You will get so many stories. There are again similar stories of intersex and so many other things.
Yeah.
Probably we can make a big podcast on this itself.
I think we should share that article in the
Yes.
description, probably
Yes.
for someone to go through it. And before we conclude, any final thoughts on this? And thanks for coming. Thanks for taking time. I think it did not take me much time to push you into it. Just a call was enough for me.
Yes.
But thanks for that. Thanks for taking time.
Thank you so much. And thank you to all your viewers, for giving this patient hearing. And I enjoyed this throughout. Narrating stories from the Mahabharata is, I just love to really talk about them. And of course, women awareness and educating women is, one of my topmost priorities. Not just, being a gynecologist or laparoscopic surgeon. I would love to encourage our women to ask more questions about their health, be aware, and take decisions, knowing well
What is
about
right.
their conditions that
What
they
is
are
right
facing.
and what is wrong.
Yes.
Yeah. And have a nice lifestyle.
Yes, have a nice lifestyle. Absolutely.
Thank you very much for coming.
Thank you. Thank you.
Thank you.